Dr. Ada, can you see me now?
Not yet.
Ah. If you can see me, can you say something in the comment section? Jennifer. Okay, Kewe can see me.
Okay.
Dr. Ada,
So
are you
since
using laptop?
no, I'm using my phone.
Okay, so all right. K baby, thank you for joining.
Just
Thank
confirm
you.
they can see me as well.
Can you see
If
my
they,
guest? Can you see my guest? Okay. She can see you as well.
okay. All
So,
right.
babe, thank you for joining. I can see you. If you can see me, say hi. All right. So, Dr. Ada, welcome to Talk Child Set with Dr. Chiemerie. I'm very happy that you joined me today. Thank you. Hi everyone.
It's my pleasure.
Thank you for joining another edition of Talk Child Set with Dr. Chiemerie. Today we have a special guest in our house, Dr. Chiemerie Onyenka. She's a wonderful person, someone very dear to my heart. I first met Ada way back in the university. She was my senior. She was my leader in so many ways, you know. And after the university, we still met again. Like 40 wanted us to continue going together, And so we started medical residency training in Federal Medical Center Yenegua, and we're doing it together before I left. She has always been my big sister, and she will remain my big sister. So Dr. Chiemerie Onyenka is a consultant pediatrician currently working with the Federal Medical Center Yenegua. She's a fellow of the West Africa College of Physician Pediatrics, also a fellow, she's a two-star general, fellow of the Postgraduate Medical College of Nigeria. Very brilliant person, very, very brilliant, smart woman. And God has blessed her with two lovely children. And she's not only going to be sharing her medical experience here, she's also going to be talking as a mom. Okay, I hope that we enjoy this session together. Please, if you have questions, do well to drop it in the chat box while I'm throwing questions at her. We'll still pick your questions and we'll ask her. All right, so let's go to the first question. Dr. Ada, I'm going to be calling you Ada Chiemerie. I don't know why you threw Ada away.
No,
Because
anyone
to
is
me, I
fine.
prefer the
And that
Ada
is
to
important.
I
It's
prefer Ada to
okay.
Chiemerie. So, Dr. Ada, what is meningitis and why should every parent take it seriously?
All right. Thank you, Dr. Mary. Thank you for thank you everyone that joined. I can see
Right.
um, meningitis is one of thank you for joining infections and one of the most serious infections you can have in the pediatric age group. And it is an inflammation of the meninges, that's the covering of the brain and the spinal cord, usually caused by a host of organisms, including bacteria, viruses, fungi, parasites, and even Mycobacterium tuberculosis, as well as other causes. But bacterial meningitis is one of the commonest causes of meningitis and one of the leader causes of meningitis. And it's very important that this topic is brought up. I'm happy Dr. Mary did, because especially for those of us in Nigeria, the countries out of the 26 countries in the African region that have hyper-endemicity for meningitis. And so it's very important that parents are aware of what it is, how it presents, what to do, and what not to do to reduce the complications, because it's also associated with a very high rate of both acute complications and late complications, including death. So talking about it is something that should be applauded, and I believe everyone will benefit from it. Thank you.
Thank you very much, Dr. Ada. Like the consultant that you are. So you are giving us, beautiful
I can't
explanation of
open
what
my face
meningitis is,
again.
but I feel it's quite, the wordings are quite too medical for some lay parents,
Yes.
parents who are not
All right.
medically
So
inclined.
let me.
So no, don't worry. When we
Okay.
continue, you just try to make it simpler for them to understand. Okay.
Your face is saying you can't see my face,
Okay.
and right now I
Okay,
can't see
she
my
said
face
we she
either. I
can't see
can't see
your face
yours.
in full. So it's like I wanted to even
In
tell
full,
you in full, yes. Your face is
so
showing, but it's like
I'm not.
yes, yes. Can you bring it down a little? Yes.
Okay. Is it
That's it.
okay now?
Yes, I think it's better.
Because I'm not going to see my face again. Okay, fine.
I'm
Let's go
seeing
on
you, don't
then.
worry. I can see you.
Okay.
Okay, so what
All
are the
right. No
early
problem.
warning signs of meningitis in babies, in children that parents must not ignore?
All right. Thank you for that question. Meningitis can affect any age group, even the newborns, infants, children, adolescents, up to adulthood. But for meningitis in neonates, that's babies within the first 28 days of life, the signs and symptoms are usually non-specific. The child might just be crying, irritable, crying uncontrollably. But one of the most remarking features of meningitis, one of the most remarkable features is fever. Usually fever that lasts for days without abating, and not responding to your regular anti-malaria, especially for those of us in Nigeria that malaria is endemic. And so for those other small children, it could also come with a drop in the appetite for the babies, poor suck. But another striking feature is convulsion, which can occur both in the neonates and in any age group. Then for the older ones, they could complain of headaches, vomiting, very forceful vomiting that occurs early in the morning, early morning vomiting. There could also be bone and joint pains, muscle pains, and sometimes a child whose eyes were normal, like some people call it 430 eyes. You see that a child whose eyes was normal before, you now start noticing that the eye is deviated to one side, like some people will say it's half past 4 eye. For a child who didn't have it before, that could also be a sign of meningitis, especially when it's even becoming complicated. And then neck pain or neck rigidity, inability to move the neck. And sometimes it could also progress, especially without intervention, into mental status that is altered. And if care is not taken, it could progress to coma. And so those are the few things that one could, see in a child with meningitis.
Okay, thank you very much. Thank you for that answer. Now, sometimes meningitis symptoms can be seen in malaria. I know you've listed so many symptoms, but how can a parent differentiate both of them? Like you already said, most times when children are not well, parents go and get them anti-malaria. At what point should they say, okay, this is meningitis, this is not malaria?
Okay, thank you for that very important question, because a lot of people in this environment attribute everything to malaria. Another thing that they also attribute everything to is teething, but that's not the topic of this course for today. But you just see people saying each time they have fever that is malaria and typhoid, and even when it's not abating. So one of the ways to differentiate it is that, one, if someone is taking anti-malaria for fever, you expect that if the person is taking the right anti-malarial at the right dose, the fever should the child. But if it is meningitis, of course, because it's not caused by plasmodium that causes malaria, the child will not respond. Additionally, some of the things I listed earlier on, like the neck stiffness, the convulsions, are unlikely to be seen in uncomplicated malaria. And that's one of the reasons why you see on your paracetamol syrup and tablet that if fever persists after 3 days, you should see your physician, because it's expected that if you start anti-malaria and all that, you should have symptoms in addition: convulsions, neck rigidity or stiffness, and seizures. Okay, that's convulsion. Plus the eye, those things are definitely not related to malaria. So at that point, it's expected that if you are treating a child with malaria, that you're expecting to be getting well, and the child is not getting well, then you should know that that is not malaria. Thank you.
All right. Thank you very much, Dr. Ada. While you were talking, Kewe has sent in her question. Can you see Kewe's question? Actually, I will read it out so you can see.
I'm seeing it.
Okay.
Okay,
Well,
but her question is, but it's about the link with ADHD autism.
so,
Okay,
Dr. Ada, can you read it out so our audience can hear the
is
question?
it
Okay. I think
thank you, Doctor. That's question is about link with ADHD and autism. Is this a myth? A lot of mothers are suspicious of this link and are now shying away from vaccination, from vaccinating their children. What are your thoughts? Secondly, we are now seeing a noticeable rise in ADHD and autism diagnosis. Is this a true increase of these conditions? Okay, there was a time that people linked rotavirus vaccination to a twisting of the intestine into another part of the intestine that we call intussusception. And even recently, when the cervical vaccine was introduced in Nigeria under the National Program on Immunization, thereby making it free. Some people also came up with such means. However, this vaccine had been in use over the years, at least from the time I was in medical school 15 years ago. It was in use, but because it wasn't given free under the MPI schedule, people were paying for it. Those who knew they needed it or their children needed it, they were paying for it and vaccinating their children. But immediately they put it under the free vaccination program, the National Program on Immunization. A lot of people came up with one thing or the other. But before these vaccines are rolled out into the public for use, these things go through clinical trials, and even after they've been marketed, they also do another stage of clinical trial, the stage 4, which has to do with the post-marketing surveillance to gather
sorry, I think she's having network glitch. Hi, Dr. Ada. Network. Okay. All right. While we're waiting for her to join us back, just to add to what she has said so far. So, Kewe, with vaccination being linked to autism, being linked to ADHD is one theory that is trendy right now. And we see a lot of parents declining vaccination. They do not want their kids to get vaccinated because they feel their children will come down with autism, will come down with ADHD. To be honest, there's no factual research that has really linked both. All you see on internet are theories and theories. And Dr. Da, are you back? Oh, she's off. So it's network. So all you see on the internet are theories by various people who their kids are probably struggling with autism or ADHD suddenly coming up. Let me see if I can, if she's back online. Okay, she's not here yet. Suddenly coming up with these theories and trying to link it with the fact that their child got immunized at 1 year, and after the immunization, their children started having autistic features, started having ADHD feature. I feel is a coincidence. It doesn't relate. If it relates, by now would have gotten research, would have gotten researches on this, would have gotten people coming to confirm this. All we see on the internet are theories and theories. We just need to encourage these parents, shed more light on the importance of immunization and let them know that they do not link autism. Then the other question was, is it because we are not getting more data on autism or ADHD? I think that's the case. Before now, we usually have people with ADHD. We have a lot of children with autism, but they were not diagnosed. We just see them on the street just behaving irrational or behaving the way they are behaving, and we're not sure why they are behaving like that. Sometimes we call them imbeciles, sometimes we call them names or restless. Sometimes I remember back then, a child would come back from school with a school report card, and the teacher would say is very restless in class. Do you get? So we didn't try to like maybe make diagnosis, or these parents were not really bothered to like, could this be ADHD? So I believe now we have more diagnosis of autism, ADHD than we did in the past. Not that they did not exist, but it's just because now we have more awareness. People are getting to know what this is, and they are coming to the hospital and they are getting diagnosed. Okay, does it make sense? Dr. Ada is the back. Yeah, she's back. She just needs to approve. Yeah, she's back.
Hmm.
Yeah, so it's your network.
Sorry,
Welcome back.
sorry, sorry.
No
Sorry for
problem.
the break in transmission. I
Yeah.
don't know at what point you stop hearing me.
I think we heard when you were talking about the immunization, when you're trying to explain the NPI schedule, the cervical smear, and the
Okay,
rest.
so
Cervical immunization, yeah.
like I was saying, these vaccines, before they are brought into the market, before they are licensed into the market, they go through various stages of clinical trials where the side effects and the efficacy are monitored before they are even licensed to be pushed into the market. And even afterwards, they still do post-marketing surveillance to ensure that, if there are any side effects of these vaccines, even after it's been licensed, it can be picked up. And that's why you can hear maybe one or two drugs after being recalled back from the market. However, these vaccines have been proven to be what they are supposed to be. There are no studies that have shown that these vaccines are linked to autism or ADHD, that's attention deficit hyperactivity disorder. And so, as far as we are concerned, as far as science is concerned, we are talking about evidence-based medicine. As far as evidence-based medicine is concerned, there is no evidence to prove that these vaccines actually cause autism or ADHD or are linked to it in any way. And so I would consider them as myths. And most of these myths are spread by, rumor mongers who do not want, the children to benefit from these things, and I would advise that you do not pay attention to them, because the benefits of these vaccines far outweigh the one or two side effects that may, come up with the bottom. Thank you.
Thank you very much. That's just the bottom line. The benefits outweighs the risk. You can't imagine your child having polio because you failed to immunize your child. You can't imagine your child having complications of meningitis, because you failed to
Yeah.
immunize your child, or measles. There's complication of measles affecting the brain as well. So the benefit outweighs the risk. Let's immunize our children. Thank you very much for that beautiful response. So, how can we prevent meningitis, especially with the role of immunization? That's just the first
The same
question.
immunization. All right. So
Yeah.
talking about the prevention of immunization of meningitis, let me just say a little that the main risk factor for meningitis is absence of immunity, or poor immunity against the organisms that cause it. And most of these organisms, especially the bacterial ones, are targeted in the immunizations that are given. Let's use Nigeria as an instance. The National Program on Immunization, when you look at the BCG that is given at birth, it prevents or helps to reduce the severity of tuberculosis. And tuberculosis is one of the causes of meningitis. When it's complicated, it could lead to tuberculous meningitis. So talking about immunization now, I would say all the vaccines that are listed in the National Program of Immunization schedule. But let me lay emphasis on the pneumococcal conjugate vaccine, that's the PCV, that is given at 6, 10, and 14 weeks, as well as the Haemophilus influenza B vaccine, which is a component of the pentavalent vaccine. Most of the mothers know it as Penta. One of the vaccines in that Penta is also very helpful in preventing meningitis. Another one is the meningococcal vaccine that is given at 9 months here. It has even been upgraded in 2024 to the 5, as in to cover for 5 serotypes of the organism, unlike when it was only 1. But after that outbreak of meningitis in the northern part of Nigeria between 2023 and 2024, it was upgraded to cover for 5 of the serotypes. And so if a child could get immunized for all these vaccines that are scheduled in the NPI schedule, then that child can be protected to a large extent from meningitis. Another emphasis to lay on prevention of meningitis is for antibiotic prophylaxis. Prophylaxis is giving antibiotics at a certain dose before the infection sets in, so which is still a preventive mechanism for those who are at risk. By those at risk, I mean like those who are taking care of people who have been diagnosed of meningitis, their close contacts, because they could also be at risk of contracting it. We usually place them on antibiotics to prevent them from getting it. Another thing is the issue of environmental conditions too that make the organisms to thrive and aid in the spread of the infection, like overcrowding and poor housing. Those are things that if you avoid overcrowding, poor housing, allow ventilation and all that, it could help to prevent the occurrence of meningitis. In addition to the vaccination and the prophylaxis where applicable, not just those who are taking care of sick people. Another group of people at risk are those with sickle cell disease, or those who probably has had anything that made their spleen to be removed, maybe by accident, or of course the disease condition sickle cell makes the spleen not to function, which is a very vital immunological organ, an organ that helps to fight most of these organisms. And so those children with sickle cell anemia, especially in the first 5 years of life, are usually put on prophylaxis to help to protect them from these organisms that cause meningitis, and is also a way of prevention. Thank you.
Thank you very much. Very exhaustive. Thank you. Professor, can you please adjust your heads very well so we can be seeing your face in full?
Okay.
Thank you.
Are you
So the
seeing me
next,
now?
yes, we are seeing you is better. The next question now is, what are the common complications of meningitis if it's not treated early?
Okay. So the common complications, most of them start in the immediate period, while some of them are long term. So like in the immediate period, there could be an increase in the pressure in the brain, and if that pressure is not checked, it could make the brain tissues to herniate into the spinal cord, to move down from the brain into the spinal cord, because there is a connection, and that can lead to death. Then another immediate complication is hydrocephalus, where the fluid that the brain swims in, the way it goes, that the route is blocked because of the organisms and what they secrete and how thick those secretions are. They could block the pathway for the flow of this fluid in the brain, and then they will build up and cause hydrocephalus, where the child's brain will become, bigger. The head size will start enlarging and all that. And from that acute stage, it could progress to become a chronic thing if it is not well managed. Other complications would include, like I said before, the deviation of the eye. They have pass 4 eye for someone who didn't have it before, but after meningitis, it could be a complication, especially why? Because the muscles that are responsible for the movement of the eye, they become trapped, and if they can't move, then the eye is fixed in that. The eye will not be able to move to that direction. Other complications would include recurrent seizures, now in the form of a seizure disorder, or what people call epilepsy. So even when the child doesn't have fever, the child is having seizures, and it becomes a chronic thing that will take more time and resources to handle. Other complications will include hearing loss, delay in establishing language. That's another complication. The person's speech will now be delayed, especially from meningitis that happened in infancy, as well as some problems with vision too can also occur when meningitis is not properly treated. So those are a few of the complications.
Thank you. Thank you very much. Thank you. So the next question is, like you already mentioned, convulsion. It can be a symptom and also a complication. Now, for example, a mom walks in on her child having convulsion. What should she do at that point? Because
This is a very
we've seen
important
cases. Why I'm
question.
bringing this question is because
Yeah.
when I was in Nigeria, I saw a lot of cases whereby the moms will put leaf, onions, oil,
Mm,
crude oil, put
don't
spoon.
go there.
So please,
Especially
what
my
should a mom
especially
do?
my neighbors.
Yeah, you see, when their children or when their child have got convulsion.
All right. So the most important thing, convulsion is a very scary experience. A lot of people don't show up in the hospital, even if the child has been sick for 3 weeks and thereabouts. until the child starts convulsing. That's when they will appear. Why? Because it's a scary experience. But in the midst of this, the most important thing is to remain calm as a parent. Because if you are not calm to handle the situation, you are likely to do the wrong thing. Just like Dr. Mary said just now, you see a lot of people using cow dung, cow urine, onions, they will mix it with pepper, with crude oil, and they still into the child's eye, nose, everywhere. And even when the child has recovered from the illness, you are now battling with the consequences of those harmful traditional practices that they had, done on the child. And so it's very important for a child, a mother, or a parent whose child is convulsing to be calm. So by the time you are calm, you're able to compose yourself. And the next thing is to turn the child to the left side. The reason for this is to make sure that, that fear that people feel when the child is convulsing, if the teeth clenches together, the child will die and all that. All those things are myths.
Yeah.
If the child is convulsing because of the saliva and all that, if the child is lying backwards, the saliva can go into the lungs and affect the breathing of the child. But if you turn the child to the left side, even if if the secretions are coming out, they will pour out and not go back into the lungs. So you turn the child to the left side, then you remove any tight clothing the child is wearing. So if the child is wearing anything that, as the movements are going on, is likely to cause some physical injuries on the child, you remove those things. And then the surroundings where the convulsion is happening, if there are any objects that the child may hit on while the stretching and jerking is going on, you also clear those things out. It's very important that you don't try to put any spoon or all those things that I've mentioned earlier into the child. And then you observe the child. If after 5 minutes the convulsion has not stopped, it is unlikely to stop on its own. Most convulsions will stop within 5 minutes. So if it doesn't stop on its own, please bring the child to the hospital for the convulsion to be stopped, because it's not nice that a child keeps convulsing and convulsing. It will be affecting the brain. And then even if the convulsion has stopped before 5 months, because it is not before 5 minutes, because it is not a normal experience, it is a sign of an abnormal activity in the brain, the child should still be brought to the hospital for evaluation. So either way, the child should get to the hospital. That's the end point of it for evaluation and treatment.
Thank you.
Thank you.
Thank you very much. So I'll go over to the next question. But before I go over to this next question, I'll just share a story. We as doctors, we tend to overdiagnose for our children. When they are well, our brain, we just be thinking about different things. Could it be this? Could it be that? I remember one time Michelle was very little and she was well, apparently well. Then, like for a whole more than 12 hours, she has not passed urine. And I was like, is she having kidney failure? Why would she not pass urine for 10 hours? I kept checking diaper. I'll check diaper. Diaper is dry. That was why I carried that. Boom, 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 boom. And that is acute children emergency. Please come and check my daughter up. Oh, she's having acute kidney failure. So we as parents, especially as clinicians, we can be very worried. So I want to ask you this question. As a mom of 4, how do you balance staying calm while still trusting your instincts when your child is unwell? How do you, balance staying calm that, oh, my child will be fine, even when you have done what you should do?
Okay. Well, you just said it, because we as physicians, especially as specialists, we tend to overtreat. But, for every mother, let me not just personalize it. For every mother, you know your child very well. That's why when mothers come to the clinic and they are telling you a child is unwell, my dear, as far as that mother does not have Murchison disease
By
by
proxy.
proxy, just listen to that mother. And that's why I tell people, if a mother wakes you up from your sleep in the night, that mother must sleep in the hospital. You won't go home. That thing that pursued you out in the night will see and we will see it because your instincts as a mother
Yeah.
surpasses everything. And
Mhm.
so, as a mother, you are the one that knows your child better. Like now, I have a very good eater at home. He eats very well. I have picky eaters too. But for that one that eats very well, once he doesn't finish his breakfast, for certainly he's ill. I can tell you for sure that he's ill. And all the children are different too. So one is that I know my children and I know how each and every one of them behaves normally. And so when I see any deviation, I will draw the child closer, ask questions, do the things that should be done in the hospital. But for other mothers, when you see your child is not well, or you notice any deviation from normal, you don't wait until it gets out of control. Another thing is that you should also not go, seeking information or therapy from the wrong people. Why I'm saying this is because some women will still notice that, the child is ill. Like you said in your story now, even as a doctor, you still brought your child to the hospital because you don't want to be biased in treating your child. Let another specialist look at your child. The same way that when you need the services of a plumber, you don't go calling a carpenter to fix it. So it actually sounds absurd when you see someone asking the neighbor who is a lawyer, to that see what is wrong with my child. And the lawyer is actually delving into into an area that is not,
His
his
specialty.
or her specialty. And at the end of the day, they will get to the hospital when it's late. Even we who are physicians still take our children to the hospital to seek the opinion of our colleagues. How much more someone who is not even in that area? So, apart from having the instincts of a mother, you still go on and, for us, ENT cases, we consult you take the child, let the ENT specialist be the person to reassure you that nothing is wrong with your child. And then the bottom line in all these things is the God factor. For me personally, that I so much believe in God. And so the God factor also comes in to help you to balance these things. But like I said, you don't overdo anyone, because some people will now exaggerate that God factor and be doing, God forbid, even when the child is deteriorating. So it's all about striking a balance. You know your child, know when something is abnormal or there is a deviation from the normal, seek the right counsel, and then trust God to do it. That's just the way to balance it.
Thank you. I've not forgotten your spiritual side. Paste. Okay, so we'll go to the next question. Um, practicing in Yenegua was a good eye opener to see diversity of people, diversity of mothers, and how they react and what they do. I remember having a mom come into the children emergency with her child. Her child had low blood level. Child was very ill, very unwell. And then we said, Madam, your child is very sick. Oh. We need to admit your child immediately and start treatment. And then the next thing is, okay, doctor, I need to first go house, go tell my husband for her, say they want to admit my pikin before we go stay. Now, I just like, why is it important for mothers to be informed and confident in making healthy decisions for their children? Why? Why? We need you to just like explain to our mothers that on their own they can make decisions. Let them know why it is important to make such decisions. Because I believe that woman, that day we talked to her, we never even gave her paper that she has to sign against medical advice. And this woman was ready to tell us, okay, where you want to make her sign? Because I know if you just doctor, I know if you just leave this my pikin like this, carry leave her for you. My husband will vex so. My husband no go agree. I need to carry and go tell my husband. And this is delaying treatment. I can't remember if this patient came back, if this child eventually died. But then I just need you to shed light and tell our mothers here.
All right. So that's like a follow-up to what I said initially. As a mother, most times you are the one closest to your child, and you are most likely to be the first person to dictate an abnormality in the child, a deviation from the normal. Now, it's very important that you are able to make a good health decision for the child. You know, one of the reasons why it seems like, especially the tertiary facilities, some people see it as a death trap, in quotes, in their words, is because the cases that finally get to those facilities are already the complicated cases, and most of all these complications are a product of early decision making, delay. It first starts with the woman in the house, then probably distance and all that, and then the woman finally gets to the hospital, and then you now tell the woman you want to admit. So many factors will come up. If it is not money factor, it will be women not knowing that they also have equal rights legally, medical legally. You have equal right as the man to take a decision on the health of your child.
Mhm.
I could remember one woman, a teacher, primary school teacher, brought in her child malnourished. And when I told her we needed to admit the child and do some nutritional rehabilitation and treat other things that had come up because of the malnutrition, she called the man, and the man came and told her, no, that they won't stay, that they will go. This woman told the man to be going, that she's coming. And the man left, and the woman brought out money from her pocket and started doing
Beautiful.
things she needed to do for her child. Why?
Beautiful.
Because she was already informed.
Mm-hmm.
And another factor is because she had her own personal money to start up the
Beautiful.
treatment.
Yeah.
That thing is one of the reasons why the women will always lean back on the man. So my advice for women is, in everything you are doing,
Mm.
in all your doings, in all your wearing of wig, in
Mm.
all your buying shoes,
Mm.
have your savings,
Mm-hmm.
because you don't know the day that you will need it.
Mm.
And the reason why it's important to make early decisions concerning your child's health is because you will reduce the complications and you will save your child. I didn't mention death as a complication of meningitis. It's actually a complication of meningitis, both in the acute period and in the long run. And so another thing is that when you present early and the right thing is done, you also save money. For instance, now, a child who was brought in before the child started convulsing from meningitis, the parents are likely to save more. Unlike somebody who is convulsing and is already in coma, that person will spend more, buy oxygen, have more hospital stay, with all the expenses associated with it, feeding, even the burnout of being a caregiver in the hospital. Those ones, you can't even quantify their financial cost of the burnout and the loss of productivity associated with it. And so it's very important that as
Oh,
a
Wale.
woman, as a woman, when you get to the hospital and you are told that your child needs care, you make that decision by yourself. You have equal rights as a parent of that child to make that decision.
Mhm.
Thank you.
Thank you very much. That was very, very brilliant. Thank you very much. So, our mothers, you've heard, you have equal rights with your husband or with the child's father to make any decision regarding your child, especially when it comes to their heads. And also, like she has already said, and I'll reiterate, please have savings. And apart from having savings, find something to be doing. Some of our women, I don't know if it is, let's say, laziness, are very lazy. Some will say they don't have the money, the capital to start off something. You don't need so much money to start off something. Even if it's 5,000 you have, you can buy non-cubes, non-cubes, put it in a tray and sell in the market. Anything, just try. Some people will even go and meet somebody and say, give me some things, some of your goods to sell for you. After selling, I will balance you. It's something. Or you go and learn handwork. Someone is weaving hair, braiding hair. It doesn't take long. Braiding of hair is not difficult. Oh. I didn't learn how to braid hair before I came to the UK, but when I came to the UK, I discovered my talents. So look for someone that is braiding hair. Learn. It will give you money. It will put more thing in your hand. So that when situations like this come, you'll be able to take decision. You'll be able to make a very good decision when it comes to your child's health. We've seen some cases, like she has just said, the father did not want the child to be treated. But because the mom has got money, she was able to push for the child's treatment. So please, mothers, find something to do. And not just finding something to do, have savings. Don't just spend it all. So when you have an emergency situation, you'll be equal to the task and you'll be able to help. All right. Dr. Chiemerie, Dr. Ada, thank you very much for tonight. You've been so helpful. You've said a lot of things, and I believe this will help educate our mothers, help educate our fathers. Can you just give us last words? What will you be in summary for today to the audience?
All right. Thank you, Dr. Merit. Thank you for my audience. So, in summary of everything we've discussed today, the take home for me is this. Number one, the place of immunization for your child cannot be overemphasized, not just for meningitis, but for other childhood illnesses. Secondly, it's very important that for any condition your child has, you seek care from the right source and seek the care early. A stitch in time saves nine. Another thing is, when you get to the hospital, you try and comply with the medical care that has been outlined for your child. Why I'm saying this is because some of the complications of meningitis also occur from poor treatment. You'll see a parent that you've told, okay, based on the organism causing the meningitis in this child, the treatment should be for 21 days, or for 14 days, or for 7 days. And after the fourth day, they see the child is looking otherwise well. The child appears well. That doesn't mean the child is well, because you are not seeing what's going on in the brain and all that. And then they tell you they want to be discharged home. And when you refuse, they will sign the discharge against medical advice form and go home. And then at the end of the day, the child will come down with one complication or the other. Hospital early to seek the right care. Most times you can even come to the hospital and all the doctor says is to reassure you that nothing is wrong. Then you know you've heard from specialists. Thirdly, comply with the care that is being offered for your child in the hospital. Thank you.
Thank you very much. Okay, our audience, we've heard from our guest. She has been wonderful. Please, before she goes, do you have any question for her? Anything you want her to say? Anything you want her to answer personally before she goes? If you have, just please drop it on the chat box and she will do justice to it. All right. Okay. Please help me thank her. Thank our guest. She has been wonderful. She's been very brilliant. Thank you very much, Dr. Ada. God bless you. Thank you for
Thank
giving us your
you, Dr.
time.
Mary.
Thank you for helping us educate our mothers and our fathers. We appreciate you. Thank you and have a wonderful weekend. Bye, everyone.
You.